This podcast is intended for veterinary professionals. Whilst members of the public are welcome to listen, please note that the discussions are designed with a clinical audience in mind and may include technical or treatment-related content. If you are a pet owner with questions or concerns, we always recommend speaking directly with your own veterinary surgeon who knows your animal best.
Hello and welcome to the Nupsala podcast. I'm Amber Weinrich. I'm a registered veterinary nurse and I'm an account manager at Nupsala. This month is Pain Awareness Month, so we're focusing on how to recognise pain in our patients and also in our own pet dogs. Today's speaker is our very own Meg Brady. Meg is a senior account manager here at Nupsala. Meg also has a degree in animal health and is a registered vet nurse with experience in first opinion and orthopaedic practice. During her time in practice, Meg achieved a certificate in veterinary nursing rehabilitation therapy and a BSAVA award in anaesthesia and analgesia. Not only that, but in 2023, Meg graduated with a distinction from Edinburgh University with a postgrad certificate in equine science. And if that wasn't enough, she's currently 2/3 of the way through a master's in clinical animal behaviour. So Meg, thanks for switching seats to talk to us today. Where do we begin with this topic?
No, thank you, Amber. So what I thought we would do is firstly look at what the definition of pain is. So there is a society that looks into the study of pain, and they are the International Association for the Study of Pain. And their definition is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. So there are some key words that are in that definition. And so pain is both sensory and emotional, and the pain could be actual, so it physically happens, or it could be potential, so that's the threat of pain happening. This definition also has some statements to kind of back this up. And there's quite a few of them, but I thought that some of them were really relevant for us working with animals in practice. So pain and nociception are different phenomena. Pain cannot be inferred solely from activity of the sensory neurons. So that's a really important thing to point out. Nociception is the actual physical occurrence and the physical body's reaction to that stimulus, whereas pain is the brain's perception of that stimulus or the emotion that is generated from that stimulus. The next statement is that a person's report of an experience of pain should be respected. And there's a phrase that's used in healthcare quite often, which is pain is what the patient says it is. And that just highlights how individual pain can be. What you feel as painful might not be the same as I feel as painful, and that individuality has got to be taken into account. The last statement that I thought was quite relevant is the inability to communicate does not negate the possibility that a human or non-human animal experiences pain. So obviously we're talking there like humans communicate through words, but we also communicate through our body language and our behaviour. That statement obviously includes children, non-verbal adults, and so it can't be assumed that just because we can't say that we're in pain, that we're not in pain. So that really applies to our animals. I think that's really interesting.
So how would our pet dogs go about communicating pain in that case?
So obviously they can't speak, and so all of their pain expression comes down to the way that they behave. There's a really great paper that I will put the details of in the show notes, that's by Daniel Mills from the University of Lincoln, and he teamed up with behaviourists from other countries to have a look at the referral cases that were sent into them and how many of those cases were behaviour cases were actually associated with pain, and then they categorised what they found within those cases. So they identified 4 main areas of behaviour based on this kind of behaviour referral cohort. So firstly, there are behavioural issues which are directly caused by pain. So that's natural defensive behaviours, things that we would probably recognise. It might be flinching or cowering. It might be snapping or growling. Or it could just be things like they are obviously lame, or they're weight shifting, or they sit oddly. So behaviour that responds directly to pain, or relates directly to pain. The second is pain causing a secondary behavioural issue to the primary issue that the dog was referred into that behavioural clinic for. And this could be an example of like separation anxiety or separation related problems, where there is a behaviour modification put in place to assist that dog and assist the owner in managing that dog's behaviour, but it's only partially successful. There's something that keeps stopping that dog from responding to the modification plan. And so in those cases, if pain can be revisited, and they can do another clinical exam, and pain relief trials might also be relevant in those cases. So the third main category that they found was exacerbation of existing behavioural issues. So this is where pain is not the original problem, but this could be a fear of loud noises in one context that is then generalized to lots of other contexts. So that's an example of that one. And then fourthly, there are behaviours which might not be seen as problematic by the owner, but can be related to pain. And these are things like clinginess, being kind of over dependent on the owner, and things like pica, like eating of unusual objects. That might just be a nuisance to an owner, but it might not be the initial reason why a dog is referred for any kind of behavioural problem. But it's definitely something that as behaviourists we would identify as that's an odd behaviour that needs investigating.
That's great. And I assume a lot of these are transferable into cats. I know we're not talking about cats today, and maybe that's another podcast that we could do. And I know that they're prey animals, so they present ever so slightly differently, but I assume a lot of these behaviours could be transferred over into those as well.
Yeah, and as you say, that this could be cats could be another podcast entirely. But cats do tend to hide their behaviour or hide their pain, so they're not as expressive in behaviour. And maybe we've all had pet cats that have actually been quite gregarious, and they might have met us when we come home, but they're not doing those things. We're not interacting with them in the same way that we might do with dogs. But definitely some of those behaviours can still occur in cats.
So in general, what kind of behaviours might we see in our pet dogs and in our patients?
So we're going to see changes in temperament and changes in performance. So when we talk about temperament, that could be efforts to repel the advances of a person or another dog. So if you go to stroke a dog in its bed and it growls, or even just a dog that moves away from you, even just maybe it's that older dog that just avoids playing with the others. They're just slight change in their temperament. But it could also be the other way. It could be increased impulsivity, where they were normally quite tolerant. They just become more impulsive and a bit more short-tempered, I think we might call that. obviously dogs can become more cautious, and we might see that with like different flooring types. They might not want to walk on certain slippy floors. Tally, my old wire-haired pointer, doesn't like to walk on like pebbles. He finds that really unstable. Or they could become anxious or depressed. And then if it's about performance, that's we're not just thinking there about sporting dogs or working dogs. That can be just the way that our pet dog performs, so the way that they move about their day. But if we're considering the sporting or working dogs, it might be that they can't jump as high, or they might knock poles down, or even they might have some avoidance. So they might just become overexcited, which is kind of like a deference behaviour. It's kind of a distraction almost. They just don't want to do that thing that you're trying to make them do. And we could consider like the puppy at training class who just gets really giddy when we're trying to do sit with them, and they're just kind of bouncing around, and they're not doing what you're asking them to. Is that disobedience, or is that actually that puppy might have hip dysplasia and they struggle sitting down? So those kind of things should be taken into consideration, that dogs aren't disobedient for no reason really.
That's great. And so for our dog owners or like vets speaking to owners in a consultation, are there subtle behaviour changes that we might not necessarily think as pain related that they should be looking out for?
Yeah, of course. So there are obvious changes like lameness, or the aggressive behaviour that's really unexpected and out of character. But those subtle things, like we mentioned with pica, that can be overlooked. So things like house soiling might be a nuisance, but actually could be pain related, could be osteoarthritis, or maybe they can't get to the door in time to ask to go outside. They could be attention seeking or clingy, as we mentioned before, if they've got a strong attachment with their owners. Things like stargazing or fly snapping could be neurological, or they could be gastrointestinal. Other things might be compulsive behaviours, such as licking, and we've all seen maybe yellow Labradors who have really stained feet, where they've been licking incessantly, and actually that's could be pain related to a joint higher up, for example, and they just can't actually reach that area, so they're licking to kind of soothe themselves with that pain. We could have noise sensitivities. So there are, I suppose, variations within noise sensitivities. Noise sensitivities that tend to occur later in life tend to be related to pain rather than those that kind of start young and get worse. And that's quite interesting. So there might be something that has like a loud noise that's occurred, and we think that when that loud noise has occurred, a dog might jump, and that just shock to the body could cause them some pain. So it could be an arthritic joint, it could be neurological, something like that. And then suddenly they've made an association between that noise in that situation, in that context, and the pain that they felt. So
to an owner, that would almost be like an out of the blue sensitivity to something that they've actually coped with their entire life absolutely fine, and then all of a sudden it's now an issue.
Yeah, absolutely. One thing that I wanted to point out with subtle behaviours is being aware of what's called the ladder of aggression. You might have come across this in practice, and I can put a link in the show notes to this, but it's basically the progression of behavioural signs that go from avoidance through to kind of aggressive attack where the dog feels like they have no option but to
because you've ignored
snap.
all of the other signs on the ladder.
Yeah. So that's what we call the ladder of aggression. And so if we ignore those small behaviours, so it's just the moving away, or it might be yawning, or just those tiny little subtle behaviours, they then lead to the grumble, the growl, the snap. So that's a really interesting diagram that can be used. I think it's in the BSAVA manual of canine and feline behaviour, but I'll put a link.
Yeah, that'd be great. So how can vets make sure they're asking the right questions to discover if dogs, like the pet dogs that they're seeing, are experiencing pain?
Yeah, so I think that's a really important point, is that we need to be asking those questions in the consult. We need to kind of take a little bit of time to investigate these. So as well as the medical history, the clinical exam, we need to be asking questions. And it's very tricky in a consult room where dogs might display like a fight, flight, or freeze behaviours. So they might not be behaving in the way that they behave at home. And that can be frustrating as an owner. Like, but he's been lame. He's been lame all morning.
You've probably
and you bring
all
him
experienced this, yeah.
Yeah, exactly. He's been lame all morning, and you bring him in, and the dog is just like, nope, I'm fine. I'm going to bounce all over the waiting room. I'm going to say hello to everybody, and I'm not going to sit still for an examination. So you're just going to have to guess. And yeah, we've all been in that situation with our own dogs, where it's very difficult as the vet to be able to assess pain without that history from the owner, and without that detailed questioning. So there are some questionnaires available. Now, if we know that the dog is in pain, or if it has a history of a condition that might be painful, we can use things like the Canine Brief Pain Inventory. And that's a quantitative and standardised assessment of pain that you can then use at later assessments to track how the dog is responding to pain medications, for example. That's really helpful if you know that the dog is already in pain. If you are unsure, then using things like the BSAVA canine questionnaire, behaviour questionnaire that's in the back of that manual, that's really useful for kind of overall generalised behaviour, and you might be able to pick things out of that. There's the sleep assessment questionnaires as well. So the snore score is really useful, and that it just assesses the quality of the sleep that the dogs are getting. It can be a little bit tricky for the owners to guess, but again, that can be a tool that can be used on a regular basis, maybe to assess response to therapies. Really interestingly, the University of Liverpool have just launched the DogMA app, which is great, and it's been designed to enable early detection of mobility issues. So again, I'll put a link to that in the show notes, because that's an app that the vet and the owner can use together, and they can monitor. They can monitor mobility issues over time. That's really good. I think signing up to that, you can have the option to be involved in further research with the university as well. So that would be interesting really for a few owners, I'm sure.
Yeah.
So yeah, even just basic, simple questions of, their exercise tolerance, or any behavioural issues that seem out of the ordinary. It might be helpful to write a timeline of events. So there might be things that you can link from the medical history that the owner it might just jog their memory as to oh yeah, actually I think they did start getting worse with the postman or people who come to the house. They did start being more aggressive or having more episodes of this aggressive behaviour after this painful thing had occurred. It might be some surgery or something like that that helps to just pinpoint maybe life events and behaviour. The other thing that's really useful is if owners can send in videos. Because obviously, as we say, if the dog is doing a flight, fight or freeze response, then having a video of the actual behaviour can be really useful.
Yeah. And what about identifying pain in our patients? How do we go about doing that?
So in patients in the clinic, we've got things like the Glasgow Composite Pain Scale. And the Colorado Acute Pain Scale. So they are commonly used in practice and they give us an objective assessment. However, I say objective because, you know, the response that you give and the answers that you give on that score might not be the ones that I give. So there is an element of variability between the vets and the nurses that are doing the assessments with those. But they look at general behaviour in the patient. You know, are they eating and sleeping okay? Are they able to move and get up out of the kennel? If they've got wounds, how do they respond to those wounds being touched? That kind of thing. And they can be used to help monitor like response to pain relief. Yeah, so again, they're helpful in the clinic setting, but they might not pick up subtle behaviours. So we've got to be aware of like the type of surgery. If they've been on medication, it would be good to know their behaviour prior to coming in, so when they're with the owners, so that we can know what is abnormal. And so to just take those kind of assessments with a pinch of salt and know that like each dog is an individual. We've got to take into consideration pain wind up as well. So central sensitisation, which can make other kind of non-painful stimuli seem very painful. So it might be that the nurse or the kennel assistant was able to give the dog a brush the day before surgery, and then you come in to give the dog a brush the next day, and actually maybe the pain medication hasn't been effective, and so we get this wind up of pain, and even the brushing could be causing some pain there. One thing that I haven't talked about, and it might have been, you know, it's relevant for when dogs just come in for an assessment in the clinic, is trigger stacking. So we might get a different behaviour in the clinic than the owners get at home. I suppose this is like the straw that broke the camel's back. Right?
Yeah, I have a dog that trigger stacks, so yeah.
So you can appreciate this. So you take the dog out for its morning walk, and there's the Chihuahua from over the road that's come out, and they hate each other, and it's really kind of setting them off. And then there's a bin lorry or the postman, and they didn't like those either. And then you need to put them into the car, but they're a little bit wound up now, so putting them into the car is a little bit stressful. They didn't like the journey. They get to the vets, they're all a little bit wound up, and then you take them into a noisy vet practice. They've got nowhere else to sit but in the corner, and you're trying to control them, and all of this is mounting up, stacking those triggers that the dog just gets to a point where they can't cope. So then being examined by the vet might just push them over the edge, and they respond in a way that is abnormal for them, or feels exaggerated. Is that your kind of experience?
That's my dog down to a T. He triggers. So like we'll see, for example, a Chihuahua, it barks at him, he's on edge. Then we'll go we live in quite a dog heavy neighborhood, so then we'll go and walk somewhere and he sees a rabbit cross his path, and that's exciting, and that will then stack on that because he might think, oh, that's really fun. And then we might walk past a dog that grumbles at him, so then that's another stack. And then he gets in the car and he's okay in the car, but he does get a bit anxious sometimes. And then if we get to the vets, that is a hugely overstimulating environment. And then by the time he actually sees a vet, he's already like up here. And it's so hard then to be like, actually, he's just quite anxious and this is just weird behavior for him. Like, this is not normal. He's just, it will almost be like overreacting, although that's horrible to say because he's not, he's just unable to cope.
Yeah.
So where he would let someone pick his legs up at home, he might be really funny about that because he doesn't know what to do with himself anymore. So yeah, it's a really big thing. I think probably more common than people think, trigger stacking. I think unless you, my dog's
absolutely.
quite, he can be quite explosive in how he then gets his frustration out. But if you've got a dog that's a bit more docile than that, you probably haven't necessarily noticed. You might just think, oh, that's a weird behavior, and then just not think about it much more.
And that's it. So there is a danger then the opposite way of saying, oh, my dog is very stoic.
Yeah.
Because we then pile things on and they internalize everything.
Yeah.
So you don't notice that they're reaching their threshold. So that can be, again, just something to be really mindful of, that in veterinary practice, the dog might not be coming in their in their happy waggy taily self. We need to make that environment as calm as possible so that we can bring them down a little bit after a car journey.
Which is so hard. It's such a hard thing to do in a veterinary practice because it is busy and the lights are on all the time and dogs are walking backwards and forwards past all the kennels, and there might be other dogs in there that are unsure about dogs, and they're all walking past each other and they're quite they're in close quarters really. For a dog that, my dog lives at home by himself, he has no other dogs in this household, so to put him into an environment where he's then surrounded by strange dogs is already overwhelming. So yeah, it's just taking all of those things on board, isn't it? As well as the fact that he also might be painful.
Exactly.
Oh, well, that's great. Thanks so much for coming in to talk to us today. As we've discussed, like, it does sound like it can be really tricky, and it's like truly objectively assessing pain in our patients and our own pets. But hopefully if we're observant enough, we can then pick up on subtle changes and in behaviour that might help get to a diagnosis or a root cause. So yeah, it's been really, really helpful. Thanks so much, Meg.
Yeah, that's absolutely right. It is very tricky. And there was some research on owner recognition of pain recently, and they looked at the most common behaviours that owners were able to recognise, and they seemed to be the ones that had a direct impact on the owners' lives. So it was whether they were, reluctant to exercise, or they didn't greet them at the door. Things that the owner they're right in their face with. It's really, really, really obvious. But then they also distinguish between younger dogs being in pain and older dogs. And actually, it seemed that people took pain in younger dogs or behaviour changes in younger dogs more seriously. Maybe they seemed more out of the ordinary.
Yeah.
And older dogs, there was a level of acceptance that this is just old age. We're just it's got a touch of arthritis. There's nothing we can do.
Like, it's almost an expectation that they're going to slow down.
Yeah, absolutely. And we've all heard that before. As we're both nurses, we worked in practice. Like, oh no, he doesn't need anything. He's just getting old. And like, well, actually, we know at Nupsala that we've got a whole host of things that could help manage them, whether that's treatments, joint injections, physiotherapy, all these other adjunctive therapies that are available to make our dogs much more comfortable and mobile.
So I know with your podcast you like to end them in a certain way. So what 3 things would you want our listeners to take away from today's podcast?
So it's my turn to do my what 3 things.
It's your turn.
So the things that I thought were most important are to remember the phrase "the pain is what the patient says it is," because it reminds us that like in non-human, non-verbal patients, pain is subjective, pain is an emotion, pain is a physical sensation, but it's always individual to that person. Secondly, ask the questions, whether we're nurses, physios, vets in practice, any other paraprofessionals. Take that time to ask the questions about the dog's day-to-day life and activity levels. And as we mentioned before, there are tools that can help you, but anything that's unusual, out of the ordinary, could be a signal for pain. And then the other thing is that if any unwanted behaviour persists, so despite training or behavioural modification, don't be afraid to revisit pain, because it could be potentially maintaining that behaviour. So even if as an owner you've taken your dog to the vets, they've had a full clinical exam and they can't really find anything particularly wrong with the dog, but if they're still exhibiting that behaviour, it's really important that we don't dismiss that possibility of pain. I think that's all.
Amazing. Thank you so much.
No, thank you, Amber. And I'll put all those links in the show notes.
Yeah, that'd be really helpful. Thank you.
Right. Bye.
Thanks for tuning in to the Nupsala podcast. This is one of many insightful episodes that we have in store for you. You can stream the episodes on Spotify, Apple Podcasts and Amazon Music. Simply search the Nupsala podcast. You can also watch on YouTube or directly at nupsala-learning.co.uk. If you'd like to stay up to date with all our latest content, please follow us on social media where we always post when a new episode launches. All the links and details are in the bio. Thank you!